Pregnancy continue 1737, page 1737. Neural pregnancy, interstitial pregnancy, ovarian pregnancy, implantation of the embryo in the substance of the ovary, phantom pregnancy, pseudocyesis, prostate pregnancy, a pregnancy that extends beyond 42 weeks of gestation. An average of 10% of normal pregnancies are so classified. Post-term pregnancies, post-maturities, surrogate pregnancy, see surrogate mother, tubal pregnancy, a form of ectopic pregnancy in which the embryo develops in the fallopian tube, tubal abdominal pregnancy, extra-uterine pregnancy in which the embryonic sac is formed partly in the abdominal extremity of oviduct and partly in the abdominal cavity. Tubal ligamentary pregnancy, pregnancy occurring in the uterine tube and extending into the broad ligament, mesenteric pregnancy. Tubal ovarian pregnancy, extrauterine pregnancy in which the embryonic sac is partly in the ovary and partly in the abdominal end of the fallopian tube. Uteroabdominal pregnancy, twin pregnancy with one embryo in the uterus and the other in the abdominal cavity. Pregnancy-specific glycoprotein, a protein found in 97% of women who have been pregnant for 6 to 8 weeks, and in 100% of those are at later stages of pregnancy. The function of this protein is not known, but it may be useful in estimating the quality of placental function. Pregnancy test, a test used to determine whether conception has occurred. In addition to the clinical signs and symptoms of pregnancy, almost none of which are reliable within the first several weeks of pregnancy, chemical tests done in the physician office are quite accurate by as early as the time the first menstrual period is missed. There are also test kits available for purchase without a prescription. If that type of test is used, it is very important to follow the directions carefully. A major class of pregnancy tests is those using immunodiagnostic procedures. There are the hemagglutination inhibition test, which requires a sample of urine, radioreceptor assay, which requires blood from the patient, radioimmunoassay, which requires a blood sample, and monoclonal antibody determination, which requires a sample of urine. In general, these tests are accurate beginning the 40th day following the first day of the last menstrual period. The monoclonal antibody test is somewhat more sensitive. The reliability of the test the test methods increases as pregnancy continues. actual ectopic pregnancy. Ovaries, villi invading tubal wall, hemorrhage in tubal wall, lumen of fallopian tube, chorion, amnion, fetus, uterus, various sites of ectopic pregnancy, uterus, exthermic, ampulla, infundibular, fembrile, intramural, intraligamentous, ovarian, cervical, abdominal, various sites of ectopic pregnancy.